a huge thank you to Ailbhe, who some of you may have already met earlier on today. She's a long-time feminist and LGBTQ and IQ activist and is the former founding head of Women's Studies at UCD. And she's been a huge advocate for women's rights, LGBTQI rights and repeal movement, and is now one of our board members. And no matter how much she says that she doesn't know about gender equality and global health, I think there is an awful lot that we can learn from Ailbhe and that we have been learning from Ailbhe, and hopefully something that we can do here collectively today to try and understand it a little better ourselves. Peggy Maguire is a political scientist and the Director General of the European Institute of Women's Health. She also was the head of the Committee in Women's Health at the Oireachtas, a former president of the European Public Health Alliance and a board member of the Agency for Public Health Accreditation. I'm picking little highlights out of their bios here because Adrienne and I are trying to keep to a strict 5 o'clock finish for everyone. But if you'd like to know more about them, please also join our organisation or get in touch afterwards. So I'm going to pull up 2 polls here now for everybody, if you just bear with. And Adrienne, I think you might be able to put the code in the chat as well. Can everybody see this? Can you see my screen? Great. So www.menti.com, and then the code is 34902524, or you can use the QR code.
Morgane, we're just looking at your desktop.
Oh, that's not. Okay, maybe I can move it over. No. How about now? No? Sorry, I can't. Oh, you can see it. Okay.
Yeah, it's perfect.
Thank you. Thanks very much. Okay. So yeah, www.menti.com and 34902524. And then the first question today is, where are you joining us from? Ireland, which makes sense for today. Dublin, that's where I am. Northern Ireland. And I suppose on that, it's important for us to know we are very conscious global health. It should be and is, should be a very diverse space. It isn't always, but we would really like it to be, and we really like Women in Global Health Ireland to represent that. And so we're very open to people from all countries and backgrounds. And so we say we're Irish affiliated. If you have any link or interest in global health in Ireland or related to it, you can join us out as a member. But Amsterdam, Netherlands, Donegal, Jordan, that might be our co-founder Paula there on the line. Kildare, Galway. I used to live in Galway actually myself. And I'm just going to pop over to the next one, but keep answering away. So, and which of the following best reflects your area of work? Research, health and care practice.
And Morgane, we can't see your screen. Whatever you're seeing, we can't see that.
Oh, okay. So it's just. Oh, yeah, it seems like my screen share stopped. Is there somebody else that's screen sharing as well by any chance? No?
It's good now, we see it.
Now it's working.
Goes. Yeah, there it goes.
Thank you. Communications, health and care practice, program management, and then other. Which, apologies if you're in the other category, feel free to tell us in the chat if you'd like it named. Okay, so a little bit about ourselves then, now that you've told us a little bit about yourselves. Women in Global Health is the fast-growing woman-led movement demanding gender equity in global health. If you were with us at the reception last night, you might have heard me say that in 2015, Women in Global Health really came about from just 4 women who were tweeting and had never met. It was just an online space and really commentating on the fact that when they were in these global health spaces, in these leadership spaces, they were often the only woman in the room, and they didn't think that this should be the case. Then in 2017, Women in Global Health launched as a not-for-profit, And in 2020, Ireland technically launched the Women in Global Health Ireland chapter with our our host and organisation, the Irish Global Health Network, at one of their COVID webinars, which was great. But it was brilliant to get to be with you all yesterday in person for the first time as Women in Global Health Ireland. Now, as of 2022, Women in Global Health Ireland is part of 41 chapters in 37 countries. 60% actually, that should reach, are in low middle income countries, and nearly 40% are in the African region. So it's another call to arms. If you join us, you're not just part of a network of women in global health or people interested in gender equity in global health in Ireland, you're also part of a far wider reaching network across Europe, Africa, Asia, the US, Australasia, and everywhere really at the moment. So why, it was one, they really came together on leadership, but also because gender inequality undermines women's rights, well-being, health systems, curtails the delivery of quality healthcare, and limits economic growth. And in order to address that, Women in Global Health specifically focuses on 4 areas: leadership, which we're going to specify again today, the global health workforce, gender responsive health systems, and movement building. And you'll see here they work in a number, they're raising awareness through media, podcasts, research, and a lot of executive summaries. And they're also an official partner of the World Health Organization, which has opened up a lot of doors for women in global health and been able to do a lot of research and make progress with the WHO, particularly where it concerns the health and care workforce. So women make up 70% of the global health workforce. And I'm just checking you can still see this, because I'm conscious I did not get that right a couple of times. And then what percentage of senior leadership roles do you think women hold? So is it 15%, 25%, 30%, or 48%? We've got 15% coming in hot, 25, 30%. No one thinks it's 48 at the moment, which I think says a lot, which I think is a strong reason for being here today. 15% and 25%. So it's 25% of senior leadership roles. It's better than 15, but not at all where we should be or deserve to be. So with that in mind, I'm going to hand over to Adrienne to why we're focusing. Oh, actually, no, leadership in global space is still me. Sorry, Adrienne. So yes, women hold 25% of global health senior leadership positions, and there's a 28% gender pay gap. And what's interesting as well is that pay gap is a lot broader than in other sectors. So not only are there gender pay gaps across the world in all sectors, it's more significant in the global health sector. And it's not just where it concerns the health and workforce, it also concerns people in positions of power in politics, who are going to represent women, men, the workforce, gender responsive policies at high level meetings that happen all over the world. Between 1948 and 2021, 82.9% of the World Health Assembly delegations were majority of men. And it's between 0 and 30% who had a woman chief delegate. The EU average for female representation in local authorities is 30%, and Adrienne will actually come on to the figures in Ireland. And then you can see here Global Health 50/50 do a lot of work around global health organizations, public and private organizations. And you can see here as well, it's not just about women in global health, it's also about where those women in global health are. Only 2.5% of board seats are held by nationals of low income countries. So when you talk about global health, how is that global? And there's stark inequalities in private sector boards as well. There are no women who are nationals of low income countries on the board seats across 43 companies that were part of their work.
Okay, so as it pertains to the Irish context specifically, Ireland is ranked 100th in the world for the percentage of women in national parliament. So 77% of DAL seats are men, and 74 to 76% of council seats are also held by men. So in 2020, 27% of women on boards of the top 20 listed Irish companies, 27% were women. And 38% of Irish listed companies have no women on their leadership team. So in December of 2021, the Joint Committee on Gender Equality was established to consider the recommendations in the report of the Citizens' Assembly on Gender Equality. which is part of what we're going to be talking about today. So we asked our members as part of a survey about a year ago what the key issues were that needed to be addressed within their specific disciplines, again, here in Ireland. So that came back with leadership, balancing life and career goals, and workplace policies holding the top three. And members reported that the #1 barrier to achieving their life and career goals was an unsupportive workplace culture. So they specifically called out systematic and unconscious bias, care responsibilities, and intersectionalities at work, such as age, nationality, and gender. So the Citizens Assembly, the first couple of recommendations, so leadership in politics, public life, and the workplace is what we're going to focus on today. So the first few have to do with quotas specifically. So recommendation #1 talks about politics. So different quotas for elections and parliament seats, that kind of thing, increasing penalties for parties that don't meet gender quotas, and a 30% threshold should be increased to a 40% for women for all elections. Recommendation 2 talks about improving gender balance on boards, so making funding to public bodies contingent on reaching that 40% gender balance quota, and then enacting gender quota legislation that requires private companies to have at least 40% gender balance according to specific criteria. Recommendation 3 is specific to public funding with regards to culture, sports, arts, that kind of thing. So a quota of 30% representation of women on their governing bodies, and 40% by 2025, 40% by 2030. And publish plans to advance gender equality within the organizations, as well as annual reporting on progress towards agreed quotas on gender representation and funding. And then recommendation 4 talks about improving family-friendly practices for all representatives elected to public office, maternity, paternity, and parental leave available to all elected representatives, including ministers, and providing flexible working options, including remote working, voting, adjusting meeting times and roles to suit caring responsibilities. Recommendation 5 talks about workplaces being required to develop, resource, implement, and monitor gender neutral recruitment and promotion policies and practices. So specific policies to promote gender equality in leadership positions, as well as a requirement to operate gender sensitive and anti-discriminatory selection and promotions processes, and equal access to training, assignments, and mentoring opportunities for all employees.
And that's it in the recommendations. And I think a final word before we hand over to Ailbhe and Peggy to take us through how their backgrounds relate to how we might advocate for gender equality in global health as women in Global Health Ireland. We understand these recommendations are a little bit quota heavy, and this was even noted in the Citizens Assembly that they can be quite divisive, I suppose, but we would see them as a means to an end. And we're also trying not to reinvent the wheel in Women in Global Health Ireland. So we're trying to put our energy where there's already been work done. And we see the Citizens Assembly and gender equality is a good place to start doing that, because as a result of the Assembly, they also set up the Joint Committee on Gender Equality in the Oireachtas in December 2021, as Adrienne said in the presentation. And we see this as being a vehicle to push for demands to increase gender equality in politics, public life, and workplace. So Ailbhe and Peggy, over to you. I think we're going to start with you, Peggy.
You're still on mute, Peggy. There you go.
Okay, good afternoon, everybody. I'm very delighted to be here. I'm working with Ailbhe and Adrienne and Morgane for this great workshop. I'm going to talk to you about the history, I suppose, give you an example of what we did in the Institute, which was set up in the 90s, a long time ago, just to let you know kind of what happened there and why it was set up. At the time, I was working in the National Maternity Hospital, and it was during their centenary year. And as part of the strategic plan, which I put together for the hospital, and working with the different sections within the hospital and asking them what they thought needed to be done, we decided that what we needed was a survey of women's health across the lifespan, younger women and older women, to see exactly what the priorities were. So as part of that, we employed the ESRI, and they did a survey of women's health. So I suppose the recommendations for that report were very, very interesting and highlighted an awful lot of issues for young women and also older women as well, midlife and older women. So as part of the launch of that as well, we held a conference in the hospital, a European conference, inviting people in to talk about health policy and what should we be doing to highlight women's health. And a couple of MEPs turned up on it, which was Mary Bonotti, and she demonstrated the fact that there wasn't anything at a European level in relation to women's health. Women's health was not on the policy agenda whatsoever. So she recommended that really what was needed was an organisation, set it up and really try and work at a European level to get women's health out there and what the issues were. I mean, as Morgane stated with all this, the statistics, I mean, health systems have failed women over the last number of years. That's the reality. We've been ignored from research right through to implementation of guidelines, etc. So when we got together, a core group of us, we looked at what was out there, and there was very little out there in relation to women's health that was in synergy that we could actually use as a tool for actually making our case for women's health. So what we decided to do was, first of all, was to set up an organisation as a charity, which we did. And then we decided what we would do, first of all, was to do a briefing document on what was happening at a European level in relation to women's health. That was facts and figures across the EU. So with that, that was our tool to bring to the Commission, the Parliament, and to organisations to demonstrate exactly what was going on. And the reason why we did that, produced a little bit of evidence base, we looked at how policy is made and what policy makings are looking for, and really what they're doing is looking at an evidence base. And what we've demonstrated, that was a huge number of unmet needs. For example, women weren't included in clinical trials, so any drugs that were being tested were tested on male middle-aged men. And from an education perspective, in the curricula there was no sex and gender, so therefore that was another issue from a systemic governance perspective. And then from the issues in the different specialties, women weren't included at all, they were treated like men basically. So on that, we discovered that what we needed to do was to have a look at policy from a systemic approach, and look at it, what we needed to look at and influence from a systemic perspective, from research, education, and then look at the different levels of support we needed elsewhere. And from that, we worked with the European Medicines Agency to try and get them create awareness of what was needed in relation to women's health. We talked to various members of the Commission, the EMA, the WHO as well were involved as well. So from very early on, we got support from the WHO and worked with them on the whole issue of sex and gender and how it needs to be mainstreamed into the general systematic approach to policy making and women's health. So that's in a nutshell what we've been doing. So ever since that, any legislation that comes out of the EU from 2003, the screening recommendations, the council recommendations, we lobbied the Trachatalis, who was the rapporteur for that report, to make sure that cervical cancer was in those recommendations. We also worked with various parliamentarians in the EU to table amendments when the clinical trials regulation was being revised in 2014, and through collaboration with health professionals, Parliament and other NGOs, we managed to get gender and age into the new clinical trials regulation, which means that any research that is done on biomedical research has to include women or older people, and there has to be a very good reason if they're not included. That's been implemented this year from January, so that's an area that really has to be looked at to make sure that it is implemented properly. From an education perspective, we've worked at various levels with the cardiologists, the European Cardiology Society, doing a report with them, with the cancer societies at a European level. And more importantly, along the way, we've worked with women themselves to find out where the unmet needs are, because the voice of women and the experience of women and how they interact with the health system, good and bad, is so important. So from that perspective, we also are working at national level. We have focal points in Austria, in Italy and Germany, and we're extending that in other areas as well. But most importantly, in Ireland, I've been working with the Women's Health Task Force as a co-chair since 2019, and that was established to hear the voice of women, to find out exactly what needed to be done, what the priorities were. And as part of the plan there was a radical listening exercise in relation to women across the life course, because there are so many unmet needs for women across their life course. So women were throughout the country from various backgrounds were asked what their priorities were. And on the basis of that, the department produced an action plan. Now, I have to say that as part of this action plan and as part of the whole process since 2019, across the policy areas from the Department of Health, all the people in charge of these areas have been involved and are totally committed and worked very hard on the priorities in the action plan over several meetings, loads of meetings over the years. And also the external strategic partners as well, such as the HSE, the Institute of Public Health, and of course the National Women's Council of Ireland, who produced a report and was the basis of the work for the task force. So I think I've been privileged to have worked with them over the last couple of years and to see the commitment of all of the people that are there. Because I think when we want to change policy is can be a very slow, frustrating situation. And you need collaborations, you need supporters, you need champions. And I think, that's, where it's worked in Ireland. I think it's a really good model of good practice where you can get all of the people together. But, thinking of the Women in Global Health Ireland, we're a very young organisation. We want to collaborate. We want to work with other people who are working in this area as well to make sure that, the unmet needs that women are suffering from at the moment and maybe the health systems are still failing, we need to rectify that. And we can't do that without good advocacy, a good champion, a good voice, somebody like Ailbhe. I'm going to introduce Ailbhe now. This is my introduction, Ailbhe, to you. But, I think the good advocacy and using the right tools and policy, they go hand in hand. And when you can actually marry these together, I think we can affect change and good collaborations. And that's how we do it moving forward. Ailbhe, it's over to you.
Well, thank you very much, Peggy, and very, very nice to be back at the conference now. And just to say that, I think it is really a very important time for us to be talking about these issues, and specifically, I suppose, about seeing more women in leadership. I mean, the figures that we've seen both globally and for Ireland are really quite frightening when you compare the 70% and perhaps even 80% of people working in the field are women, and only 25% of the leadership is female. I mean, this is just simply an inequity that has to be rectified, quite apart from the difference it'll make. But it is a very crucial time because there are so many issues globally which really have very particularly gendered impacts. And I'm thinking obviously of the pandemic, and people talk about us being post-pandemic, and I'm really not so sure about that at all, but where women have been carrying a very heavy burden, and therefore that impacts on their families and places increased burdens on health services. War, need I say more, and migration, refugees, which follows on from that, recession, which is related to that. And then you have obviously things like the increasing catastrophes which are due to the climate crisis. I don't talk about climate change anymore. We know that there's change. The thing is that change is now at a critical point. And again, it is women and families, women who are bearing the brunt of that in family situations. On top of, I mean, that's all, on top of the huge problems that we always have with us, the persistent poverty and famine and drought, and the persistent inequalities which cut right across our globe due to racism, homo and transphobia, misogyny, ableism, ageism, and what have you. So I think it's really very important for us to do this. And it's great to have that insight from Peggy on the policy making and effectively where it's at in relation to women's health here in this part of the world just at the moment in Ireland and in Europe. But the key question always is, how do we get those policies actually put in place? How do we accelerate a process which Peggy, somewhat understating matters, I think, says can sometimes be very slow. Sometimes it can be so slow that you wonder if it's ever going to happen at all. And that's no reflection on the fantastic work that you and your colleagues do, but it can be frustratingly and also sometimes dangerously slow. So I'm just going to say a few words about advocacy and campaigning. I don't describe myself either as an advocate or really even as a campaigner. I'm an activist, and therefore I like to see action which is going to get things done. But fundamentally, advocacy and campaigning and activism are all fundamentally about the same thing. They are about changing things that are wrong in the world and using whatever means come to hand, as it were, to achieve those changes. They make advocacy and campaigning and activism make a huge difference, not only to the symptoms of the problems that we identify, but also to the root causes. They can and do and must tackle the systemic and structural arrangements and frameworks and scaffoldings which produce the symptoms which are highly problematic and painful and distressing for so many, and which of course perpetuate the inequalities that we know. I think that, I'm just thinking that so much of the change that we have seen in Ireland in this and kind of related areas over the past decade or two have really come about via advocacy, via campaigning, and really through the power of people actually being encouraged and inspired to stand up and to demand better care, better services, changed laws, freedom, equality, human rights, and so on and so forth. And I'm thinking obviously of our big referendum campaigns within the last 10 years on marriage equality and repeal of the eighth, but also the very important trans recognition law that went through our parliament. And that was not because politicians suddenly did a kind of mind switch and said, oh yes, let's do a law. That was the result of a decade of campaigning by trans and other LG organisations. I'm thinking of Peggy was mentioning the National Women's Council there, of the sterling work that the council has been doing over a very long period of time to try to get a good childcare service and system here in place in this country, without which it is really pointless to talk about equality in any absolutely meaningful way for women. I think about men's violence against women and how advocacy in that arena has been so powerful, and where we're in the fortunate position at the present time of having a Minister for Justice for a woman who really did push through a strategy on gender-based violence and sexual assault and rape and so on, which is undoubtedly better than we might have expected it to be, because there was a huge commitment there and she could galvanize people. I'm thinking of the brilliant work of those very brave women, not least, of course, of Vicky Phelan, who really revealed and exposed the whole scandal around the smear testing. And, that was extremely powerful, and that was entirely driven by people power. I'm thinking of smaller things too, maybe, but also very important, the right, for example, for relatives and particularly partners to visit their partners in maternity hospitals during COVID, where there was a very random system in place, and women rose up actually, and many of their partners as well, and began to push for that and achieved a liberalisation of that situation, which was very important. So that's in a way to say that we have different kinds of campaigns, some of them over a long period of time. People sometimes say to me, did we get repealed very fast? And I'm thinking, oh no, not if you think back to 1983, we didn't. But some of them quite short and sharp, like the visiting in maternity hospitals campaign, for example, or indeed even the smear test campaign where that has, I think, very largely been rectified. So we are very fortunate in Ireland in that we live in a democracy, and that we therefore can advocate and we can campaign and we can take activist action, so to speak, without expecting there to be very severe repercussions. You do pay a price, perhaps, particularly as an activist, maybe over a long period of time, but nothing like the cost that you might pay in, for example, Iran, where I really do admire the women and the young women and the girls in Iran who are standing up to the mullahs and actually saying, "Get lost, mullahs," was the latest one I saw on Twitter, which is just so important. Also thinking of women and girls in Afghanistan, and thinking too of people who are protesting and campaigning and advocating against war in Russia at the present moment. So, you know, there are so many examples I could be giving there, that we have a great privilege here, that we can raise our voices with impunity. We may not be loved for it, but we can do it. And we should make use of that, not only on our own behalf, but on behalf of women and girls and people globally. We can speak up more than for ourselves. And I think that's where the Women's Health Global Health Network is so important, because we have that confidence, we're coming from a relatively good place, and we really can push quite hard. So ideally, advocacy and campaigning should always be conducted by the people with lived experience of whatever wrong it is they're seeking to have corrected. And I think that's really very important. Breda Gann reminded us in an earlier session today, nothing about us without us, which has been a constant cry across the decades of campaigners. And it is very, very, very important indeed. But it does occur that we will need at times to be speaking maybe on behalf of people, or we may find ourselves in representative positions. And that is something that we need to always think very carefully and bear in mind, that speaking for someone is not the same as being actually that person, and trying to grow those spaces in which multiple voices can be raised to speak or write or talk or tweet or whatever it is about those real experiences is very important. I'm just thinking back to the role of stories, women bearing witness and giving accounts of their experiences during the repeal campaign, which was so very powerful. So that's point number one. There is no single method for advocating or campaigning. It's usually a kind of a mix of methods that you use, things like consultations, position papers, lobbying, and lobbying can be very simple kind of one-to-one meetings or phone calls and so on, or it can be groups going in to do a briefing, say in the AV room in the Dáil. It can be much more organised, or make a trip over to the European Parliament or the Commission. Lobbying is whenever you seek to influence an individual or a group in a direct way in relation to a particular issue. And sometimes people feel maybe there's something wrong with that. There's absolutely nothing wrong with that. We now have accountability procedures here in this country for checking that that process is not abused. Media visibility, of course, is extremely important in raising public awareness of issues, and information and public awareness campaigns are really important. Networking, I always come back to networking, in particularly for women, that we need to network more. And men are very good at networking. I don't know why, maybe they've more time actually to network, but women are shyer perhaps about networking, and yet we have very good friendship circles. So let's think about those and see how we can get our networks to move. I've lost my timidity now about networking, and I directly ask people, can they do this? Will they do that? Will they get involved? And so on and so forth. And there are also advocacy organisations. I'm on the board of Age Action, and we call ourselves an advocacy organisation. Our role is to go out there and fight for better rights, better services, a bit of dignity and respect for older people. And there are many such organisations. And of course, there is activism. And that is when you decide to get out on to bring your campaign perhaps out onto the streets in a very public kind of way. And I'll just put in a little plug for the 10th anniversary Savita March on Saturday, 1 o'clock at the Garden of Remembrance, when we'll also be fighting for an expansion of our abortion law and the provision of services nationally. And I would never underestimate the power of the feet on the street, because while social media is a wonderful asset and a great tool, it's also a somewhat double-edged sword, because of course it can also be used to intimidate, to hassle, to threaten those of us who do stand up and put our heads above the parapet, because whenever you're campaigning, whenever you're advocating, you have an opposition. You will always find an opposition. The best thing to do with an opposition, as far as you possibly can, is to ignore them and to keep putting your message, your position, your need, your demand out there as firmly and as strongly as you can. There will be times when you have to deal with the opposition, but that should not ever, ever be your number one goal. Your number one goal is to convince and persuade those who have the power to make decisions about the issue that you want to see changed. That's your job. That's your job. It's not to win an argument. It is actually to persuade those people. So the checklist, and this is the end, are you need a clear aim. What is it you want to change? You have to be clear about that. It won't work if you're not. Then you need to work out what are the best influencing strategies, advocacy and campaign. Will you need to get out on the street, or is it going to be all lobbying, or will some research do the trick, or is it a mix of all of these? What is your action plan? Who? Where? Who are they? How many are you? 2 is no good. 3 is the beginning, and you could build up from 3. Time frame is really important. It's no good saying to people it's going to take us 35 years like it took for repeal. You have to say it's going to take us a year. It's going to take us 2 years. And then if it is longer, you just keep expanding that time. Finally, you implement the plan, and as it goes on, you constantly monitor and evaluate so that you can adapt and adjust and evolve. And the very last thing is that when you win, you take a breath, you celebrate, and you say, it's only ever one step. The next step is next. So there is no giving up. There's no stopping. You get a bit of a pause, but then you start again, because there are so many issues. That's it. That's me. And I think we're back now to Adrienne and Morgane, because we're going to be going into our breakout rooms. Am I right there?
Yes, you are. But I think I just done it quickly. That was incredible. I mean, I think we feel so lucky to get to listen to you, let alone I'm so pleased that everyone in the room is going to get to hopefully put this into action, because I think some of the words, I mean, solidarity, intersectionality, and you both picked up on the importance of women's voices and lived experience, and then being strategic and actually knowing what you want to say. So I think this is at the core of what we'd like to do as a group today. Hear what the community of people interested in global health in Ireland want to say about leadership. What is it that you think out of these recommendations? Those are our aims. What do you want to say about them? Which of them do you want to talk about? So we're going to ask you quickly, I'm going to put the recommendations in the chat. And then we're going to bring up another poll, and hopefully I'll get my screen sharing more efficient this time. And then we'll ask you to vote on your number 1 recommendation out of the ones that Adrienne had covered that you would like us to cover today. The number 1 recommendation and the number 2 recommendations as voted for you will be the breakout rooms that we're going to go into for 25 minutes. And there's a number of questions that Ailbhe and Peggy will walk us through. And these will be opportunities for you to engage with us as well, ask as many questions as you want, and we'll also have time for reflection at the end to hear from you as well. Bear with. Can you see my screen?
Yep.
Great. Oh, people have started voting. That's incredible. Okay, it's the same Mentimeter from before. So it's www.menti.com, and the code is 34902524. Recommendation 5, recommendation 1. So recommendation 5 was on transparency, I suppose, in training opportunities, recruitment, hiring, promotions, and opportunities for mentorship in the workplace. Recommendation 1 was on politics and on quotas for our political representation in Ireland. This is something that for us as Women Global Health Ireland is important as well, because it aligns very strongly with Women in Global Health Global's agenda. So it's interesting to see that people here today think it might be something interesting to look at as well. So in the interest of time, unless I might call it there for number 1 and well, it's still number 1 and number 2. So if you voted and would like to talk about recommendation number 5 on transparency and reporting on recruitment and hiring opportunities for women throughout the workplace, you're going to pick breakout room number 1. And if you would like to talk about quotas and leadership and politics at the DAL, you can pop into breakout room number 2. So breakout number 1 will be Ailbhe and Adrienne, and breakout number 2 will be Peggy and myself. So to join the breakout room, I'm going to stop the screen sharing. And I think IJHN have prepared the breakout rooms for us. So if you click more and then click breakout rooms, you should be able to pick room 1 and select join, or room 2 and select join. So don't click the leave button, please stay with us. Click the more button to the left of it and click either room 1 or room 2.
Should we be getting that up on our screens too, Morgane?
Can you see the leave button at the bottom of the screen?
Yeah.
And you have to click more and then breakout rooms.
Not everyone has their camera.
So
Okay.
we're all here back in the main room. So we have
Great.
20 minutes left. So myself and Adrienne will scroll through the slides, and I suppose just in the interest of time, maybe if Ailbhe and Adrienne, if you want to reflect on that room and also questions from the people or further comments from the people in that group.
Oh, I'm very happy
just to share it back with
to
you.
reflect on that.
You go ahead, Ailbhe. You go ahead.
No, really.
Oh.
You were taking some notes. Well, just to say that, look, we started our discussion, I would say, and we were just getting into the swing of it when we were told we had to finish. So we don't have a specific policy, but a number of really interesting points were made. And Adrienne, if you were able to keep up and to, take a note, it would be very helpful if you might just remind us of a couple of those.
Yeah, if you can go to the next one there. Morgane, there's more on the next one.
Yeah.
Because a lot of our conversation focused on the challenges, of course, and then there were a few solutions. Things like modeling after countries that are doing it well. So somebody in our group pointed out that Scandinavia, in terms of parental leave, they don't even differentiate between maternity, paternity, parental. It's all parental leave. There's a 50-50 split now, I believe. And so, that I guess what I took from that piece of the discussion was that we don't need to reinvent the wheel, as it were, right? Find places, countries that are doing it well. I know someone had in the chat earlier, even just the politics piece of it. Rwanda has over 60% of their seats are held by women. So, what's happening there and how can we kind of model after that, as opposed to trying to start from scratch, because we don't need to. Just, obviously childcare came up over and over again, and just that knock-on effect that it has in a number of different ways. So Frederick was pointing out just towards the end there that we need to be able to provide options for women who want to go back to work without doing it on the backs of already marginalized women. Just the where did I put it there? There was also something someone had pointed out about, if we can recognize the contributions of women who choose not to either go to work at all or go back to work, and what they could offer to kind of society as a whole for those who do choose to go back to work. and being able, but there needs to be a different, we need to change how we view women who make childcare their main focus.
Thank you. Thank you very much. Thank you very much, Adrienne. I mean, I think it was probably ambitious to think that we would move further than that, but you did actually see some of the solutions. I think there's absolutely no doubt that the emphasis on the challenges and was very, very strong, and that workplaces are not accommodating for women. They're not accommodating women. And I mean, I think myself that there was a very good, I think it was Nadine actually put into the chat that we need, if I can actually find it now, it's just there somewhere, or Nadine, you might actually say that we don't need anti-discrimination policies, we need pro-women stroke non-binary policies and practices. And I think that's a very good point, a very important one. And I would even say that we actually need workplaces, and it's something that I think we're all very conscious of, that recognise the complexity of people's identities, people's experiences, and also people's needs at different points of the life cycle. And unfortunately, the workplace model is still based on a male who comes in at age 22 or 3 and just carries on without any kind of home, personal, any kind of problem in his life. So I think that it's a whole workplace mentality where we have to get rid of that male model worker, or the model of the male worker. We've got to get rid of that, and I would certainly like to see us being able to take that much more integrated approach, which also accounts for the intersectionalities, which mean that a woman is never just a woman. She's also in a particular place at a particular time, from a particular culture, ethnicity, and so on and so forth. It was we could have gone on for much longer, couldn't we? They're not saying yes because we're all on mute.
No, definitely.
We could.
We definitely could have,
I think that's about it there on that one.
No, I feel very strongly about this one. I'm sorry, I was just copying and pasting some stuff from the chat and being very biased and putting life-friendly policies for myself there, because I do agree with how it came out, and I think it's great that it was framed that way. I mean, for men and women, workplaces look very different, and we're beyond paternity and maternity at this point. And that's the frustration. We're only playing catch up with these policies now, and we're already thinking beyond that. So it's great to see that reflected.
There was something else that I forgot to put in there, that we were talking about childcare, but there is other dependent care. Obviously, if we have children who have disabilities or special needs of any kind, and then subsequently, as you grow older in your life, you may have the care of older people, your parents or other older relatives, and that is increasingly a problem.
I'm just going to stop sharing my screen so people that are here can see each other, because I'll go through then room 2, and we were on quotas, but I'll bring it through you, so hopefully you can get a sense of what we discussed. I think why we felt that this policy was important was to aim, I mean, and the earlier session spoke about this, it's not just women who should be pushing gender equitable policies, but at this point, we really do need to get more women in leadership positions. We need all genders' experiences reflected in policy and legislation. And we feel that this is a vehicle to also support gender in all policies. And when we talk about health in all policies, we need gender in all policies as well. And that this has gone on for far too long. And that at this point, women won't be adequately represented until the percentages, the quotas change. It has implications on the economy. And also, I think this conversation, it was about political quotas specifically, but that this applies to leadership in all areas of our lives. There is comment that this is how it looks in my organization as well. So that this kind of conversation is reflecting that too. I mean, our policymakers make decisions that implicates our daily life as well. It's not just about the global health arena, about our politicians who are going to World Health Assemblies or UN General Assemblies, COP27. It also has implications on work-life policies, you know, the correspondence with the other recommendation that you were discussing And that, I suppose, the barriers, the challenges that the group discussed were unconscious biases of the women themselves who might not put themselves out there. And I think there's some, it wasn't in the group, but there's a great group called Women for Election that are trying to address this, trying to promote and networking and training opportunities for women who might be interested in representing and being in politics. Gender stereotypes are a challenge to having women in politics. And also, I think what reflects the recommendation that you discussed, women often have other burdens of unpaid work that they might feel prevents them for going for these opportunities. Often this is a bit of a juggle when you're political representatives, especially at councillor level as well. And that point from earlier that leadership inequality isn't just in politics, it's hard to tackle everywhere. So, and then the CV gaps that might as well come with that unpaid work and care and responsibilities, that leading to either you feel that you won't put yourself forward, or you're also being seen as somebody who doesn't have the experience to come forward. So one solution to that is amend the selection criteria, remove those kind of biased selections, understanding how men see this as well and engaging with men as allies, including them in the conversation, and having these conversations in the public sphere and starting these conversations early, starting talking about women in leadership at schools. And also this quota was for TD levels, but we also thought about introducing this quota at councillor level as well, because that's where it really starts. And so how would we tackle this? I mean, practically even, just there was a comment that this online facilitation helps us have these conversations. It's easier for some people to join online. It was really nice to see everyone yesterday, but a lot of us, I mean, not everybody is in Dublin or can get to Dublin. So it would be great to keep online conversations. That's how Women in Global Health Ireland actually communicate at the moment, because very few of us are actually based in Dublin or even in Ireland, which is really nice. So we've always gathered online. Women in Global Health Ireland would make a declaration of support for quotas, come up with a statement. Hopefully more people in this room will join us in crafting that statement, and also surveying people on their opinions of experiences of women in leadership and their opinions of quotas and their experiences of leadership. And being opportunistic to amplify our message, a Gender Pay Gap Day, using National Women's Days as opportunities to add, we're a small group, how can we kind of create traction and join together ourselves and with other groups. I mean, Women for Election, National Women's Council was mentioned earlier by Ailbhe, make up the committee on the Task Force for Women's Health. I know it's those are time bound, they meet in time bound restrictions, but we know that there are people who have worked on similar issues that are out there for us. So that was what we discussed. Peggy, I don't know if there's anything to add. Anyone else in the group who wants to add to that? And seeing the chat is popping, which is lovely.
I think you covered it all, Morgane. I think it was a great group, and I think very positive. 52% of women in Ireland, so therefore we need representation at a legislative level, and really we need to hear women's voices when legislation is being prepared, and we haven't got that at the moment, not sufficiently anyway. And I think great, I think very similar to you, Ailbhe and Adrienne, your workshop, the whole multitasking of women, the caring,
Yes.
Looking after children, looking after sick family members, etc., across the lifespan. It's not just for young, it's not just children, it's older people as well. So I think that has to be taken into account. So I think political parties have to be more facilitative when it comes to women and involving women in the party. And I think one point was very well made, that women themselves really are speaking in their own heads against themselves, they don't feel adequate. So again, as Morgane said, this is sort of a lifespan approach from an early education perspective. Women's confidences have to be built that they're capable, more than capable of getting involved in society and making societal changes. I think, again, it's hearing the voice.
And everybody has to understand right across the workforce that having a balance between one's working life and other parts of one's life, whether that's family or whether it's other interests and pursuits, is actually healthy and is good for everybody. So, organizations and workplaces which seek to drain us of everything, that is not contributing to global health. Au contraire, it's absolutely exhausting people. And everybody needs to resist that, I think. It's lovely to have. It's lovely to have little Sophie with us there.
So I think so. I mean, I think these topics are so relevant for Global Women's Health Ireland because the work-life balance is to be implemented now. We have to look and make sure that it is implemented properly on behalf of families, women and men, and also the quotas. That's again is still being discussed disgracefully at European level. So I think that's another opportunity to influence. So I think we could do with an awful lot more expertise within the group as well, to support us in highlighting both of those issues moving forward and working on them.
Well, I must say I really liked Nadine's suggestion there that came in on the chat for a series of workshops, which looks in more detail at some of these issues. But I keep coming back to the point that when we talk about work-life balance, I keep asking myself, how is it to be got into the heads of men, we'll say somewhat arbitrarily, over the age of 45? Now, I'm just making an arbitrary cutoff point, that they really have to change their approach and their attitude. And that's the bit that I am very nervous about, because I think we can achieve that. A great deal can be achieved with younger men, or at least there is a possibility there, and it's a very real one. We see some of the changes already, but I remain to be convinced that that can happen without specific actions being taken to ensure. And I would just love to see men, I would love to see all the CEOs of Ireland being put into an equality training workshop.
Absolutely.
But they're the people who need it.
But Ailbhe, 45 plus, we have to remind them they soon have grandchildren, and they're going to want time out to look after, maybe spend quality time. But you know what? I think unless we get this, and you're so right, unless we get this equality in the home, men and women working together to look after the children, the family, the caring, there's no such thing as proper gender equality. And that's a discussion I think we should really have to have in one of these webinars as well, so that we can take action and maybe write an article, do some blogs, have some podcasts even. Ailbhe, why don't we interview a 45 plus CEO?
I think because they wouldn't do it with us. I think they would very wisely say no. But I'm thinking that also, of course, opens up the ground for something that has been a theme today, and certainly I imagine throughout the conference, that it is also about not just seeing women as this kind of block, mono-dimensional women, but that as women we come from very different contexts and backgrounds, and that there is a whole myriad of inequalities that ground people's lives. That's true of men as well, and that a workplace which seeks to tackle inequality on a gender base, there is some chance that it can then open up and begin to see the importance of tackling inequities across the board, and to understand how these are complex factors that are interwoven into people's lives, and to see the absences and the deficits and the gaps in their own workforce, and therefore the kind of talent and intelligence and understanding that they're missing out on.
Absolutely. And it's already been proven that if there are more women on boards of large industry, that the actual company itself is more successful and more economically successful. So maybe what we should be doing is gather all that information as well, to make the case to the over 45-year-olds as well. That maybe present them with a little page and say, look, what do you think of this? Let's have a discussion.
But the interesting thing is that, we all laugh when we say things like that, but actually there is a real problem, which is kind of breaking through that concrete wall. There's no such thing as a glass ceiling. The whole thing is made of absolute reinforced concrete, on which there is now a levee, of course. But anyway, it is all there. And I think that is still the problem. And that is actually about peeling away those layers of power and control. I don't think we should take anything for granted. Enough of my own experiences
people say to me, I didn't know women weren't included in clinical trials. Even some medics say, I didn't know women weren't included in clinical trials. So, men, maybe we need to involve them. I think, I think Noah said, involve men in the conversation, and let's give them some sort of, what do you think of this? Maybe they don't know, or maybe they selectively don't know, but maybe we just need to highlight it again, and you make them our champions, or some of them are champions. Why not?
Absolutely. I'm just looking, there are lots of good things coming in on the chat, which
I can't see anything.
Oh, can you not see the chat? Well, just looking at the chat there, thanks to everybody for, continuing. It just shows that we could actually continue this kind of conversation, and maybe in the network, I'm looking at Adrienne and Morgane and thinking, yes, why not? We could set up something, and also going back to the idea of mentoring, maybe mentoring in all kinds of different sorts of directions. Perhaps we could maybe mentor men as well. That would, but I think that there are real things that we could do, and try to feed in and make a submission to the All Party Oireachtas Committee, which is actually headed up by Ivana Bacik, and she was the other day, and she was saying that they are actually working on this at this very moment.
Fantastic.
Perfect. So Morgane, do you want to wrap up then? I think we've got a lot of great stuff to take and work with, and I think we'll definitely have something tangible come out of this, which is super. Morgane's just put our the Women in Global Health Ireland kind of information in the chat there, Twitter, Instagram. We're on Instagram. I don't think that one's in there though. Our email address is in
if you
there.
have it.
That's fine, no. And then the link to just sign up if you're interested, and we're more than happy to have you.
Yeah, I think definitely this is just the beginning. 25 minutes is never going to be enough, but I think it's clear that there's more that we all have to say on this, and we would love to hear more about what you have to say. I mean, even that piece around mentorship, I think implicitly and indirectly, if you're part of this network, we're part of a community together and learning from and supporting each other. It doesn't always have to be so formal. I think it'd be great if we could do more in that area, but I think even just by joining this group of women, that would be a huge support to us all. And definitely the Joint Committee, we had this planned for a good while now, but only actually got our run sheet yesterday. That was my fault. But the idea, if it was to engage with the Joint Committee on Gender Equality, and they have been for the last 3 weeks, have been meeting with groups specifically about these recommendations. So there's a lot here for us to say, and if we have something specific to say about it, we'd love to put something together with your views expressed in that. So I hope you do and click the link to join, because it's free, it's for volunteers. We're very clear about the burden of unpaid work and volunteering for women, and we don't want to perpetuate that. So you get involved however you feel involved, whenever you feel that you can be. And so you'll hear from us and follow up on how you might, and areas that you can get involved in this. And then there's multiple other areas of women in global health for working with you if you have other interests. So keep an eye out for us, and thank you so much for staying on with us till 5. Sorry we went over, Nadine, and enjoy the close of the conference and the rest of your long weekend.
Yes.
Thank you so much, and thank you so much, Peggy and Ailbhe. We love having you as board members. It's been a pleasure for us to have this time with you, let alone sharing it with everyone else, and just it's brilliant to get to work with you.